Right, everybody, good afternoon. It is Wednesday, 1 o'clock. Thank you so much for joining us about our waste changing in HTM 0701 webinar today. So as you guys all know, we have been sending out a lot of mail shots and a lot of information about the new changes in the waste guidelines. We have also got two very amazing people from Initial Medical. Initial Medical are pioneers in waste. They do provide a lot of waste contracts to dental practices and medical practices. Some of you might be using them right now, and some of you who are looking to open dental practices, you can definitely get in touch with them. They're very reliable, very good company when it comes to waste management. And today we've got the lovely Andy and Rebecca who would be talking to us about the changes in the HTM 0701. So they would be outlining what some of these changes are, what are dental practices required to do in order to adhere to some of these changes. And if you guys have got any questions at any point, please feel free to put them all on the chat box and we'll try to answer all the questions as quickly as we can. This webinar is recorded, so if you have missed part of the webinars or if you need to go, we will be putting that on the YouTube channel and we will be sharing the whole of the webinar with all our lovely followers and audience. So don't worry if you have missed it out. Just few house rules. Please make sure that you are in a quiet environment. If you're not in a quiet environment, you can mute your mic so that to make sure there's no disruptions all throughout the webinar. The webinar will last approximately 30 minutes. So we will go through some PowerPoint slide, give you guys some guidance on what are the changes and what are you required to do. And then if you've got any questions, please feel free to ask us. So let's start. Thank you so much, Andy and Rebecca. So can I just do a quick mic check? Can everybody hear me okay?
Yes.
Yeah?
Yes.
Yeah.
Yeah.
Perfect. Thank you so much. Amazing. Thank you so much, guys. Just want to make sure while I'm babbling along that you can still hear me and I'm just not talking to myself. All right, perfect. So thank you so much, Andy and Rebecca, for joining us today for our webinar about waste management. I know there's been a few changes and I wanted you guys to go through some of these changes that have come about and what are dental practices supposed to do in order to adhere to the changes that have happened. So let's start by talking about the new bags, the tiger print bags everybody's talking about. All I'm seeing everywhere right now is tigers. So on my Facebook, there's tigers. On my stories, there's tigers. So what are these tiger bags all about? Let's get into it.
Yeah, perfect. So as many of you will know, the HTM 0701 was republished by the NHS in March of this year. And then the BDA have come out very recently, a couple of weeks ago, to make specific recommendations and prescribed necessities for dental practices with regard to this change in the way we want to do some of the waste management. The key thing to mention is that legislation hasn't changed. The law is still the same. The regulations are still the same, but we're looking for better ways of handling waste within our industry. And so the introduction of the tiger bag stream, the offensive waste stream into dentists, allows for better segregation. And really that's the emphasis of the HTM 107 is better segregation of waste from infectious waste streams in the orange bags to non-infectious waste streams in the offensive waste, and really trying to segregate out what goes for alternative treatment, what goes for waste disposal lower down the hierarchy.
Perfect. Okay, so what about embracing the core values? We have heard that there's been some core values when it comes to waste management, like environmental protection and reducing the carbon emissions as well.
Yeah, absolutely. So one of the main focuses of the BDA and the NHS indeed in redoing some of this guidance is to embrace those principles, is to focus the way we do the clinical waste strategy across the healthcare profession on the circular economy, environmental protection and improved social outcomes, reducing carbon emissions. And so all the steps that have gone into putting the HTM 107 together and the BDA's guidance are focused around those things. And so when you speak with your initial medical consultant locally, when we're talking about this today, those are the emphasis, those are the aims, is how do we do right by the planet in the way that we handle controlled waste within the dental industry.
Okay, great stuff. And then we move over to that different type of waste classification. As we are aware, within the dental practice, there's so many different types of waste, and the way they are classified, it has to be like in a particular way, using a particular different type of waste disposal bags and containers. So what are the latest update when it comes to waste classifications?
Yeah, so thanks, Ala. Again, the legislation hasn't changed, the regulations haven't changed. What's been really specific now, and the BDA have been really specific, that with dental practices, you have the opportunity to put waste that shouldn't really have ever been in an orange bag into a tiger bag. So if you are dealing with patients without a known infection, that waste is therefore not potentially infectious and doesn't need to go into an orange bag. There is the opportunity now to place the waste, swabs, gauzes, tissues, gloves, PP into a tiger bag, which then doesn't need to go for the alternative treatment process. What that does mean is it's an increase in segregation, so it's an increase in number of bins actually at the point of treating the customer. It's an increase in the number of waste storage areas you need, because those two waste streams need to be kept segregated and separate.
Yeah.
But it does offer that opportunity to classify the waste as offensive if it's been produced in the environment where there is no known infection in the patient. One of the really key things to mention there is you can still go up the waste hierarchy. So you can still classify into an orange bag waste that could potentially be in an offensive stream if circumstance doesn't allow for two waste bins and two waste storage areas. And so that's really key to mention, is that this doesn't necessitate a change right away. It gives the opportunity to better segregate the waste streams within the dental practices.
Great stuff. I'm just letting a few more people in while we go along. So the other question that a lot of people asked us about is extracted teeth. So how are we managing extracted teeth now? How's that changed?
Yeah, so it's funny. Some dental nurses put extracted teeth in sharps bins. We recommend a dental tooth box, and now with the new BDA guidance, it offers the opportunity for teeth that are not contaminated with amalgam, so don't have any amalgam present at all, to go into the offensive waste stream. There's obviously, and you can see from the image on the screen, there's obviously a risk there with those teeth puncturing the bag. Bags are intended for soft waste only, and so if they are going to go into a bag, then they need to be wrapped securely, and you may want to just consider odours there as the teeth may be in situ for a while. We would still recommend, Initial Medical would still recommend, that teeth, whether they contain amalgam or not, go into a tooth box. If you've got one on site anyway for teeth that contain amalgam, use it for the teeth that don't as well. There's plenty of capacity, there's plenty of storage space, and it means that you don't run the risk of tearing the bags or getting smells in the practice room. But that is a slight change, where before people were either putting it in a tooth box or a sharps container, it can now go into the offensive waste stream.
Oh, perfect. That's good. So what is the impact on the practices? So what impact do you think that would have on the dental practices?
Yeah, so as I said, one of the main intentions of the BDA in releasing this is to look at that circular economy, reducing carbon emissions, best practice in terms of social responsibility. And so there potentially is some cost savings to be made there. There's absolutely some environmental impact change to be made there. And actually, through better segregation, what we're finding is that people are more aware of what their waste management policy internally should be. They're more aware of what the wider strategy is. And so it just focuses the mind, really. And so there is opportunity for both cost saving and carbon emissions reductions. But absolutely, it's about us all within the industries that we're in playing a part in that greener and healthier world that you've got on the screen there.
Good. So the old ways, as we know, like, currently there are some things that we're not able to, for example, lack of distinctions, missed recycling opportunities. So there are some things that we're currently being done that shouldn't be done. So what would you say the new ways are? How should things be done going forward?
Yeah, so again, I don't want to labour the point too much, but I think it really is important that the regulations and legislation hasn't changed. And so if you were following the HTM 701 that was published in 2013, then legislatively, compliance-wise, you are still okay. What this is really aimed at is improving the way we do things. It's taking it up a step from bare minimum compliance to best practice, and to finding ways that we can better segregate, identify and dispose of the waste, that we're not putting things into a waste stream that goes for high temperature incineration or alternative treatment that doesn't need to be, and so reducing the impact on the environment. There's also some really specific instruction in the BDA's guidance around amalgam waste, amalgam separation, amalgam not going to the sewer. So again, looking at how we elevate what was there before the legislation remains, but best practice in terms of minimising the damage to the planet, as well as embracing potential cost savings and circular economy and social responsibility.
Perfect. Thank you so much, Andy, for that. Now, in terms of obviously all these changes, as Andy has said, these are some of the changes that are taking place. From a CQC point of view, some of the things that they would like to see when they come out to do your CQC inspection, and it's relevant to waste management, is a pre-acceptance waste audit. Andy, can you tell us about what is a pre-acceptance waste audit and why do we need to do that?
Yeah, absolutely. So this is something that's really important at the moment, especially if we're thinking about the way we classify waste, the way we identify and segregate waste. A pre-acceptance waste audit is you, as the producer of potentially hazardous, potentially infectious waste, declaring what that waste is, where it's generated, what happens to it, why it's potentially infectious. And so that pre-acceptance audit now will change slightly from how it's been previously. If you're going to start putting waste into tiger bags, then that pre-acceptance waste audit is your way of declaring and identifying the waste streams that you're producing on site. And so if waste is going into a tiger bag stream, that's something that we can identify on the pre-acceptance waste audit. That then goes to the company, whoever they are, that's collecting your waste. That can also then be provided to anyone who's disposing of your waste, but we can track through all the way to make sure that we've segregated and correctly identified the waste at source within the practice. So then as it goes through the chain, we know what we're handling, why we're handling it in the way we are, and it can be disposed of appropriately.
Perfect. So guys, apart from the waste acceptance audit, some of the other things that you guys need to look at and update is your waste disposal policy. So how you are disposing waste. So if you're going to be using, the tiger bags for the non-infectious waste, please make sure that this is highlighted within your policy as well. From Smart Data Compliance, being a compliance provider, we're definitely updated all our policies and our paperwork. Even the infection control audit, the waste section, we've updated that for you guys as well. So going forward, when you do your infection control audit, the section where we talk about waste will be slightly different. And then you can have, the different waste disposal charts. Again, you can get it from the initial website or our website, and that's really good as well. And it tells you where each waste can go, especially when you have training nurses who might not be aware of the new waste classification or segregation, then that's something that, having on display can help as well. So that's all there. And if somebody needs a hand with the system or want to know where all these compliance templates are, you can always ring us or give us a call or email us as well. We're always here. And if you guys have any other questions about waste management, a nice quick short webinar to just give you a quick update of what's happening in terms of your waste management and what you are supposed to be doing. So thank you so much, Andy and Rebecca, for joining us on the webinar. Guys, if you have any questions for Initial, please feel free to message us and we can liaise with them and give them all the questions and they can help you answer it. But as you guys, as you've heard, Andy, with the tiger bags, the non-infectious waste would go there. It's not mandatory at the moment, but that's something that has been recommended. And what you are required to do as a dental practice is be aware of the latest regulations. Make sure you have a pre-acceptance waste audit. The waste disposal policy is up to date and the infection control audit is all up to date.
Yes, but the one thing I would stress on there is that Initial Medical obviously got nationwide consultants who can go into practices and give best practice advice bespoke for the individual practice on this. And so absolutely reach out to us. We're more than happy to help. One of the key things that the BDA have been really explicit about or specific about in their guidance is the need for amalgam separation. And one of the things I would stress there is that actually your current waste provider may not be able to provide you with an amalgam separation solution. And so even if you're not an Initial Medical customer, please do reach out for some advice, guidance, and especially with regard to amalgam separation, we may be able to help there where your current waste supplier isn't. It's really important that as we look at the sort of the overarching aims of what the BDA are doing here is that we correctly classify, correctly segregate and correctly identify the waste streams within the practice. And so as part of that, it's about how do we provide not just a solution for capturing the amalgam, but for recycling it. And we have our own in-house recycling facility where we can recycle 100% of the amalgam waste that comes from sludge collector cups, dirty sinks. And as part of our ISO 14001 environmental certificates, it means that we're continuously looking at better solutions, improved solutions on how we handle that. So if you do need help, if you do need bespoke, unique advice to your surgery, then please get in touch with Initial Medical and we'd be delighted to come and do a site survey, a waste management assessment with you in the surgery. It may be that you can accommodate tiger bags and do that. It may be you can't, and we can look at that individually with each practice to look at what might suit you best.
We've got a question here, Andy, from someone. They're saying that suction tips, are they still able to go either in the tiger bag or clinical, as there's something about they possibly split the bag, causing accident to the carrier? Thanks. We had been told to possibly place them in a sharps bin. So they're talking about the suction tips, the large saliva injectors.
Yeah, perfect. Rebecca might have an answer to this one. My recommendation would always be anything that potentially punctures the bag shouldn't go into the bag. The bags are designed for soft waste. It's a really easy way to transport, contain and identify waste types. And so anything that may puncture the bag shouldn't go in there, but Rebecca might have a more
Yeah, I definitely agree with that, Andy. I think, again, one of the things that potentially is missed off of the BDA guidance is actually talking around the sharps containers and the use of them and getting that correct in your dental surgery as well, because I think you have varying kind of procedures that you're doing on site. One of the things that is cited in the new HTM 0701 that was released is the potential colour change that you might see of some of your products. So the industry as a whole, and especially Initial Medical, we're really focused on providing the product as sustainably as we can. The yellow plastic is really, really hard to create sustainably because of the virgin pigments that have to go in it. So it's usually a kind of virgin polymer. Over time, you'll probably see, if you're with Initial Medical, you'll see that the colour of the sharps container is kind of dulled down. It's kind of a mustardy gold colour now. And that's because we've introduced recycled plastics within those. So they've currently got 40% recycled plastics, but we're trying to increase that even further to 100%. So they may even go to a grey coloration. But remember always with these, the lid colour and the label colour is what dictates the kind of colour code guidance. So specifically for a dental surgery, you should be looking at having your yellow lidded sharps container for all of your medicinally contaminated sharps. So that would include anything from your anaesthetics line. Potentially it's fine to also put your carrier tips in there, but if you wanted to totally segregate those out, and as it's not medicinally contaminated, they could go in the orange non-medicinal sharps container. The other one to take into consideration on your site is if you're doing any kind of Botox treatment. Botox is typically a cytotoxic chemical, and that should be going into your purple lidded. So colour change of the base of the sharps container, just look out for that. And then make sure you're using the right sharps also, as well as the bin. I can see, and we've got another question around, are you supposed to have an orange clinical bin as well as an offences? Yes, if you are treating potentially infectious patients, you will need your orange waste as well as your tiger. As Andy said, you can go up the hierarchy. So non-infectious waste can go into an orange bin, which is why typically dentists have always had the orange infectious waste stream in a dental surgery, but you cannot put infectious waste at any point into a tiger offensive bin. So you can go up, but never down.
Perfect.
I was just going to say, Saba, just on that point, so it's incumbent upon the healthcare professional who's dealing with the patient to identify, is there a known infection? And so can this go into a tiger bag stream, or should it go into an orange bag stream? And so what we're finding is within the industry is that some dental practices are staying with just an orange bag, remaining as the legislation hasn't changed, and so just staying with what they were doing before, because it does provide them a compliant and a legislatively compliant solution. And some people are placing a secondary bin in the practice room. So they've got an orange bag for those who've got a known infection and a tiger bag for waste. coming from patients without a known infection. Some places that is practical, some places it isn't, but it does give you that option for additional segregation and improvement in the way that we do things in terms of carbon emissions and environmental impact of the waste produced.
Okay, thank you very much for clarifying that. Okay, have we got, can we place both orange and tiger bin?
No, so again, any waste stream that you are producing on site will need to be segregated. So if you have both an orange and tiger bag on site, you would need to have those in a locked, separate storage area. So if that's inside your practice, they'd have to be segregated within the room. If you've got external storage, you would need 2 yellow wheelie bins outside, one for the orange and one for the tiger. As soon as a tiger bag, if an orange bag went into a tiger bag, that would all be classified as infectious. So you need to keep your non-infectious and your infectious waste streams completely apart. Just like if you've got sharps containers, you couldn't put those in with your bags in a wheelie bin as well.
Any more questions?
Just on that point, it may or may not be practical within your surgery, within your practice, within your property footprint to accommodate this. And so having an orange bag is still compliant. Having only an orange bag is still compliant. If you want to explore the opportunity for orange bag and tiger bag to better segregate and achieve some of those benefits, then please reach out and an initial medical consultant can come to the practice and have a look at what's practical and what's possible. More than happy to do that on a premise by premise basis. So yeah, please do let us know on that.
So we've got another question. It says, is this going to become mandatory? Also, is there a guidance that you need to put up in my staff room?
So what's mandatory is what's always been mandatory is that we properly dispose of, identify, segregate and dispose of the waste we're producing. So what is mandatory is that waste that is potentially infectious goes in orange waste stream. What this does is it gives the opportunity for, not mandating, it gives the opportunity for segregating out waste that is from a patient who does not have a known infection, so that it can be better treated and handled. I would absolutely recommend you visit the Initial Medical website and look at the follow the colour code signage. There's some brilliant posters. There's some brilliant resources there under follow the colour code that can be used for guidance. If you're doing staff meetings and stuff, again, an Initial Medical consultant would be more than happy to come and support with some of the training, some of the information, some of the guidance around what you should be doing in terms of each member of staff. There's some resource available to you on initialmedical.co.uk.
Okay, much. Thanks a lot for that, Andy. I think we are coming towards the end of our webinar. Thank you so much, Andy, and for joining us, and everybody who has joined us today. I hope you guys have had some clarification about waste management. I hope this webinar has helped you guys to understand what you are supposed to be doing, what is mandatory, what is recommended. As I said, here at Smart Dental Compliance, we have got everything all uploaded on the compliance template. So if you need any help or if you need any resources, we're always here to help you alongside with the great team of Initial. If you guys have got any questions around waste management or looking for a pre-acceptance waste audit, they're always there as well to help you. So thank you so much, everyone, for joining us. I hope you guys have a remaining lovely lunchtime. The weather in London is looking really good. So I hope wherever you are, it's sun shining, and looking forward to the weekend. Have a good rest of the week, and we will speak soon in the next webinar. Thank you so much.